Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. 10 minutes past 8 o'clock. It is Thursday morning, the 22nd day of January, 2026. Good morning, everyone. I'm Scot Michlin. Thank you for tuning in to KSJE 90.9 FM over the air right here in San Juan County, New Mexico. In Durango, Colorado, we broadcast up there at 103.3 FM. And if you're listening anywhere else on the planet, you've gone to our website to tune in, ksje.com, of course, or maybe you're using the new KSJE radio app to listen. But it's great to have you all with us this morning. I also want to send a welcome out to our viewers who are joining us. This program is being streamed live to the KSJE Facebook page and also to our YouTube channel. So welcome aboard to you as well, everybody. Glad to have you with us, because coming up in the next few moments, my guest this morning from the San Juan County Partnership this morning. Lots of things going on at the partnership, and we'll be learning more about that, hearing from one of their newest staff members, and much, much more coming up in the next few moments right here on KSJE, so stay tuned for that. Then, of course, next hour, Mick Hess is going to be here, Roving with the Arts, our weekday classical music program. That begins a little over an hour from now, a little under an hour from now, actually, at 9:06 on KSJE. Don't forget, of course, you can also connect with us on other forms of social media like Instagram, Blue Sky, or X. So check us out there if you're a social media person. And if you're a podcast person, you can subscribe for free to listen to KSJE podcasts. You'll find them wherever you're listening to podcasts these days. Or better yet, you can just sign up and use the new KSJE radio app. Podcasts are right there. You can listen live. It's all right there, available now at the App Store or on Google Play. Outside our studios at San Juan College this morning, it is 22 degrees outside. Kind of a partly cloudy morning, I would say. We are expecting a partly cloudy day today, with a mix of sun and clouds, with a high of 46 in Farmington this afternoon. Partly cloudy skies overnight, the low 31. Mostly cloudy day tomorrow with a high of 49. And then take a look at the big change in the weather coming up. As you no doubt have heard, chance of rain or snow showers Friday night and on into Saturday. And Saturday night, a 70% chance of rain or snow showers Friday night with a low of 34. More chances for rain and snow on Saturday, 70%, 38 degrees for a high. And then on Saturday night, again, 50% chance, rain and snow showers, low 22 before things clear up again. But cooler temperatures on the other side of that. Sunshine 35 for a high on Sunday. Sunshine 37 is all we'll get on Monday. I'll be back with my guests from the San Juan County Partnership right after this on KSJE. KSJE is supported by San Juan Regional Medical Center, whose vision is to deliver world-class care, making life better for the communities they are privileged to serve. Offering a comprehensive range of inpatient, outpatient, and emergency care services so residents can live life better here. San Juan Regional Medical Center, community-owned and operated, here for you. Ready to make a difference close to home? The University of Denver Graduate School of Social Work Four Quarters program is accepting applications for the 2026-2028 Master of Social Work cohort. Classes meet Fridays in Durango, letting you keep working. Learn more at du.edu/socialwork/fourcorners. Students can change the future with DU and apply now for lasting impact.
Now back to Studio A and the award-winning Scot Michlin Morning Program on KSJE.
And back in Studio A this morning with my guests, as I mentioned, from the San Juan County Partnership. Always great to have them here, including Executive Director Anna Krutsky, who is here this morning. Good morning.
Good morning.
Welcome. Good to have you here.
It's always a pleasure. Thanks, Scott.
Thank you very much. You brought with you one of your newest staff members, as I said, right? So we want to introduce her as well. Welcome to you. Thomalisa Yazzie is here this morning. Good morning.
Good morning, everyone.
You're a program manager now with the San Juan County Partnership.
Yes.
Very good. Well, welcome. And we'll learn more from you in just a moment about the work that you are doing. But let me go back to Anna Krutsky for a minute to find out more about what you're up to these days and managing all kinds of things, right?
I am. We are busier than ever. It's actually pretty exciting.
That is exciting.
Spring is coming, believe it or not.
Right. Glad to hear you say that.
And with spring, and I start thinking about February as the beginning of spring.
Yeah.
We have the Healthy Living Expo, which will be
right.
happening on February 21st. It's a Saturday. It'll be from 10 to 3 at McGee Park.
Right.
It is a free event, and it's very family friendly. We'll have a ton of folks, businesses, nonprofits, organizations from all over the region talking about healthy living and what they do. We'll have the single track bicycle group again, and that event for the kids, and there's going to be food. There is a cost for food.
Right. But no cost to get in.
But no cost to get in.
Right.
Correct.
Got it.
I do believe that there are still booths. So if you go to our website or contact Amanda Evans with San Juan County Partnership, we would be happy to get you set up with a booth if you would like to be part of that event.
Very good.
So
I know
that's
a big event coming up for sure. And I remember talking with Amanda a little bit about this too a few weeks ago. So there's a program on our podcast list, everybody, if you want to learn more details about the Healthy Living Expo. But I know they have a very generous definition of healthy living. So
Correct.
if your booth fits into some type of healthy living, chances are you could get a booth at this event. And there's no charge for the booths either, I think, right?
There's no charge for the booths either. This is an event through San Juan Health Council.
Right.
This is our third annual event, and it has been well attended, and people seem to really enjoy having something of this nature that time of year.
Yeah, which is great, because I think it's been growing too over those 3 years.
It certainly has.
So congratulations on that.
Thank you.
That is coming up, and we'll remind you about that again at the end of the program as well. But at the partnership these days, again, you are growing. Thomalisa is a great example of that.
Absolutely.
She's new, right?
Yes. So Thomalisa is new. We have a new grant through the state, which is focusing on prevention efforts, which is the foundation of what we do.
Right.
And that particular grant is really working to continue the work that we were doing on overdose prevention efforts. So Thomalisa, and she can talk a little bit about what that's going to start to look like. We're just building what some of the scope of work and what specific activities we're going to be doing. But that's really focusing on preventing adult overdose deaths from substance misuse, polysubstance specifically. So multiple mixing substances, which can create dangers.
Got it. Interesting. And that's kind of what we see, I guess, when you're dealing with individuals like that. It's maybe there's not just one addiction. It's multiple things that then leads to these problems and potential health problems or
and it
death.
Doesn't necessarily have to be addiction. It can be a first-time experience for somebody who may be experimenting and taking something that they don't know what they're taking, and that can be dangerous. And if you mix substances such as methamphetamine or fentanyl or other opioids with alcohol, it can reduce your respiratory functioning and can put you at high risk.
Right, exactly. Thomalisa, let me come to you then and talk a little bit about this new job for you. When did you start with the partnership?
Well, it's really great. Thank you. I've been with San Juan County Partnerships beginning of December.
Okay.
So it's really good to be back out in the community in the prevention world and, educating our community members and some of our partners just what are some of the risks of overdose.
Right. And this type of work isn't necessarily new to you, right? Because you've done some of this work before in other agencies, other capacities too.
Yes, I have. So I do have some experience in that also. So looking forward to continuing that work.
So as Anna was saying, with this new grant, what are some of the things that you are looking at to kind of define what you'll be doing with this grant from the state? You have kind of your overarching goal, I would think, but then specifically, what are some of the things you think you'll be working on?
So one of the things that we'll be doing is creating an overdose prevention kit, which we'll be working with some of the treatment centers, the CPSW, CHRs, and creating like a what is stigma? What are some of the
Sure.
dialogues of stigma? And then also like some of the stats regarding overdose risk, polysubstance use, how to identify what are some of those dangers, and also creating a warm handoff referral, strengthening that referral system with the treatment facilities in the area.
Got you. And is there a certain strategy when you're working with adults rather than maybe younger people with something like this? Do they tend to be maybe a bit more stubborn or need a little bit more, helping along the path, I guess, to help them when they're older than younger, I guess?
Yeah, there is a big difference working with the youth and also with the adults. With the adults, they've some of them have done it already. They've already had that experience, and trying to encourage some of those individuals could be a little challenging because they know some of the dialogue, the language that you'll be using with them. But just the care, the support, encouragement that you offer them, and then showing them what a healthier lifestyle could be also.
Sure.
And then like with the youth, they're very wanting to absorb a lot of that education and working with them and making it kind of a fun project and activity and engaging with them to kind of, grab their attention that this is what could happen.
Right.
And so, yeah, using those two different formats with the two different adults and the youth can be, it's you just kind of have to gauge your audience.
Each are unique.
Yes.
Yeah, understood. And you mentioned something I wanted to follow up on too, which is that warm handoff, because that's a really important component, I would think, of any type of work like this, to be able to help people through this and then also just not say, well, good luck, but be able to say, here's some more resources now to help you to continue this journey that you are on, because it can be difficult to break this habit, to break this, even if it's not an addiction, could still be a bad habit.
Yes.
And so that warm handoff is an important component of this.
It is, yes, definitely. And being able to know with the community partners the treatment centers that we'll be working with, already creating that dialogue with them, so that way they know that we'll be bringing in these individuals. What is that going to look like? And for them to let us know how that's going to look like, so we can, show these individuals that it should be a smooth process for them.
Right. Very good. And Anna Krutsky, I want to come back to you a little bit about this grant that Thomalisa is defining and explaining to us a little bit, and that whole idea of the warm handoff and the whole prevention part, which is in your name, the San Juan County Partnership and Prevention, to be able to help these individuals, I guess, longer term than just kind of for a short period during the grant.
Yes, I mean, we're always looking towards sustainability. Any grant that you have and all of the work we do focuses on how do we sustain the growth that we've gained and the efforts that have been made, and what is working and how do we continue that. So working with our partners, we have a community action coalition that meets the third Wednesday of the month.
Okay.
I am trying to make sure that's the correct.
Okay.
It's the third Wednesday of the month at 1 o'clock at the partnership offices, and we have quite a few partners that participate in that. And so we collectively work on trying to maintain those relationships, talk about what we're doing, and have those folks who participate talk about what they're doing and how do we collaborate. So organizations like Presbyterian Medical Services, Senacor, which is inpatient services.
Right.
The San Juan County's Mental Wellness, the Navigation
Center,
right?
Yes.
Remember the names.
But you also work with the governments too, city, county.
We work very closely with the county. We work with the cities. We try to make sure that everybody is aware of what those resources are, utilizing 211 through United Way as another source. How do you find the resources that you need, and how do we connect you to those? And if you're running into problems, we definitely can support you in that process.
Right. True. And the whole concept of prevention, I want to just pick up on that a little bit too, because I think that's been proven time and time again that it is a money saver when you're talking to things like governments, to say you can either put a bunch of money in the after the fact, or a little bit of money prior to these addictions or problems with these folks in your community to try to prevent these more expensive things from happening down the road.
Right. So prevention And it's so, the partnership really is about prevention and community wellness. Prevention is an upstream focus. It is focused on education. So right now we're doing a huge amount of work in the Farmington middle schools on prevention education with curriculum
Right.
to help them learn about like what is the science around substances and addiction. How do you foster refusal skills that are much stronger, things of that nature. So that's some of the things that we do with youth.
Sure.
And
'Cause
educating providers.
Right, and pardon me for interrupting,
Yes,
but I just
please.
wanted to say, but it could, because I think if they don't hear that message, then they're on that path for the next 60 years or what have you that could lead to health problems,
Absolutely.
potential death, I guess, overdoses, what have you, all kinds of
Yeah.
problems. And that's
Yes.
was why I wanted to interrupt
Yeah.
you. Sorry.
No, it's a good interruption to have. One of the other things we're doing with this particular new grant, we actually not just have an adult focus, but we actually are going to have a youth focus as well. And with the youth focus, we're going to be really targeting kiddos who are highest risk. So we're going to work on figuring out how to identify those kids and thinking about youth who may be struggling with being homeless or having
Home insecurity?
home insecurities, things of that nature.
Okay.
And they tend to be the highest risk for substance starting at a young age or continued problems because of the situation they're in.
Sure.
So we're actually in the process of hiring an associate director, and we should know who that individual is within the next couple of weeks. I'm super
Okay.
excited. We're in the
I can
interviewing
tell,
process right
right?
now, and I really, really am excited.
Takes a little off your plate.
It takes a lot off of my plate. So that individual is going to focus completely on learning about prevention, become a certified prevention specialist. So that brings us to, about 5 or 6 of us in the community now, which is really exciting because it is a very specific science in order to support these upstream prevention education efforts. So that individual is going to be building a youth coalition and learning about what the needs of high-risk youth are in our community and addressing those. And we're going to have about 5 years to really dig into this and look at how we're going to be able to sustain some of that in the long run.
Got you. And all these things that I know we talk about when we have someone from the San Juan County Partnership on the program, it really comes from grant funds. I mean, you don't have
Correct.
a pot of gold in your basement that funds your efforts. I mean, all these things, you are applying for grants, you are being awarded grants and things like that to do this really important work in these communities, whether it's from the state, the county, the city, the federal government,
Correct.
all of the above. That's what really drives a lot of the work that you are doing, you and your staff.
It is completely community driven and it is 100% grant funded focus. Yes. So the Department of Health and Human Services at the federal government level has an entire curriculum, and there's a training process, and there's a system called the Strategic Prevention Framework that allows us to figure out from planning all the way through execution and delivery of services, gathering data. As everybody
Right.
knows, is one of the things that we do in order to have an understanding of what specific activities or targets we need to be focusing on. We do have the New Mexico Community Survey coming up in the spring, which we help facilitate for the state every year. That will be happening, I do believe, in March and April. We are in the process of training staff right now to do that, so we'll have 3 or 4 folks out in the community. It will also be advertised with the potential to win some gift cards, I think up to $1,000 through the state, so that we will put that out online, and we will go out into the community and do paper surveys as well as surveys on a tablet.
Right. And by doing that, that gives you then that local data, I guess, that helps
Correct.
drive some of these decisions and some of these grant applications to say, this is what our community is saying is happening and what they're being impacted by most frequently.
Yes. So if you look at our San Juan County Data.org website, which has a huge amount of information about this, which we keep up to date, this information allows us to like you said, gather local data so we have an understanding of what use patterns are with adults. This is for 18 and older,
Right.
this particular survey, around alcohol, opioid use, methamphetamine use, cannabis use, which we're still really trying to understand across the state and in our community. And then we can compare that to the state levels so we can see, is this a full state issue? Is this a local issue? And what do we really need to be focusing on?
Sure. And I guess, too, from looking at the state, they can see, what's happening in different regions of the state. If it's all, like you said, if it's one thing or one thing's happening just in the northwest corner.
Yes.
And maybe trickling down into other parts or vice versa.
Absolutely, yeah. And we do see differences. Sometimes we have a higher proportion of alcohol use disorder within our county than we do in other counties across the state.
Right.
We do not have really a large issue around heroin or cocaine use. That maybe like Rio Arriba County has a higher heroin usage and less alcohol usage. So there are some regional differences, and the way that we approach prevention and education to the community and the providers that we work with is a little different based on those regional numbers.
And from getting that, I guess then someone in your position can then look and see what grants are available to address these specific needs in our community?
Yes, absolutely.
That's important. And so with that, then it seems like the work of the partnership has kind of changed and morphed over the years, at least a little bit to me. I mean, the idea of prevention still goes on, but I can remember talking about drunk driving and this and that and some of those issues that was a big deal, and it's still a big deal, don't get me wrong.
Absolutely, still a big deal, but we've made some headway.
Right, I guess that's what I'm trying to get to with that long-winded question. Yes.
It is working. Education works, and we are seeing the collective efforts of the community and the state showing some differences. So we have less youth drinking early than we used to, say, 15, 20 years ago. We have drunk driving through a lot of law enforcement efforts as well.
Sure.
We work really closely with them and DWI programs
I was going to say
locally.
Law enforcement courts, all of them working together,
all
right?
working together, and that's what makes the difference.
Yeah.
So, and collecting the information and having an understanding of that, and then being able to show that we are doing good work, and it is changing.
Yeah. Which is exciting to see.
It's so exciting. It's why we do what we do, because we can actually start to see, hey, these efforts are paying off, and we are saving lives.
Yeah. That's important, and so that's great. My guest this morning from the San Juan County Partnership, talking about some of the work that they do each and every day, and again, this data-driven work, and so there's probably other things that I'm not asking you about this morning, Anna Krutsky, but tell me what we haven't gotten to yet, because we still have a few minutes remaining this morning.
Right, so part of our community wellness activities are housing assistance programming, and one of the things that actually helps drive funding for housing assistance as well, and really focusing in on people who are experiencing homelessness, is the point in time count. It's called the PIT count. And so we have volunteer community members who have been trained or are in the process. And at the next week, we will be counting how many people are experiencing homelessness on January 29th. So you count for that day. We have several days to complete the count, but we're specifically asking about that day.
And this is happening in communities all over the place?
This happens nationally.
Okay,
so
on that
this
day.
Is on that day.
Understood.
So, or those few days around that day, but we're talking about where did you sleep on January 29th?
I got it.
So the federal government does this point in time count across the country to understand how many people are unhoused currently, and then those numbers are given to a state entity. So in New Mexico, it's the New Mexico Coalition to End Homelessness, collects all of that data, writes the report, and then gives that report to the federal government, and that can help through the HUD, the Housing and Urban Development at the federal level, have an understanding of how many people are unhoused and what we need to do. So we use that data at the state level to inform some policy around housing, and then we use it locally to have a better understanding of what the needs are here.
Right. And you're getting data on adults and children?
Yes, so there'll
As
be
well?
so there'll be data. I mean, it's adults have to complete the survey,
Sure.
but if they are have children who are also unhoused, they would count those within this survey process.
Right.
It takes about a half an hour to 45 minutes, so it's a lot. We are going to be out with some supplies. I know that we've been able to collectively as a community with hygiene kits, with hats, gloves, socks, and gift cards. We're going to be giving out $5 gift cards for people who would like to also participate in this. So
Gotcha.
you will see folks out and about doing that.
Okay.
Or maybe not see them because they are going to be at
Where
places
those-
where people are unhoused.
Right. But you know where those are.
We know where
And
they
I
are.
guess law enforcement does too, and you
Law
work with them
enforcement,
too.
we work very closely with them.
Yeah.
Yes.
Very interesting. And I guess the count in the shelters too would be part of this as well?
Yeah, so there's a shelter count that actually goes along with this. So the PATH shelter will be counting, and they have people trained. We just actually last week did a Narcan training for the PATH folks so that they
Nice.
were all able to have Narcan with them when they do their count and be able to distribute that if needed. And the expansion with Presbyterian Medical Services is also going to participate in that count as well. So those are the two large shelter organizations within the community. So that shelter count will also be given to the New Mexico Coalition to End Homelessness and be part of that report, which is usually released later in the summer, July, August.
Gotcha. And again, as you said, that data helps to drive, I guess, decisions and funding to
It does.
deal with this issue in every community.
Absolutely.
Got it.
Yeah.
Very good. And so, what else are you planning to be doing here in the next few weeks besides hiring your
Hiring
assistant, which
somebody
I know
new.
is probably number one priority on your list, right?
Yes, it is. That would be number one. And
Okay.
hopefully in the next 2 weeks we'll get that taken care of. Thomalisa, Amanda, and I are going to be heading down to Albuquerque for the Office of Substance Abuse Prevention recipient meeting.
Okay.
So we do that a couple times a year, and meet with our fellow folks around the state who are doing similar prevention effort work, and get some training and do some networking and connecting with them and seeing what great ideas that they may be doing or what we're doing, and we can share and collaborate on those efforts across the state.
Gotcha. Very good. Well,
Yeah.
never a dull moment.
Never.
It sounds like for me, for all of you at the San Juan County Partnership. Before we go, another plug for the Healthy Living Expo,
Healthy
if you
Living
wouldn't
Expo.
mind. And the dates again coming up in February, right?
Saturday, February 21st from 10 to 3, so it's
Right.
all day at McGee Park. There will be food. There are registration booths still available, so get a hold of Amanda Evans or San Juan Health Council, and you can sign up for a booth or just come and enjoy.
There you go. And learn more about healthy living.
Healthy living in our community, there's a lot of it.
That's true, and what it all means. Very, very
Yes.
true. And Thomalisa Yazzie, thank you again for coming in and with your new position, and good luck with all of that.
Thank
and
you.
please come back and tell us how it goes.
Yes, thank you for having me.
You're very
I'm
welcome.
Looking forward to it. Thanks.
You're very welcome. Thank you both for coming in.
Thank you, Scott.
Always great to have you here from the San Juan County Partnership. My guest this morning right here on KSJE. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.